COPD patient is in need of having their respiratory drive supported, there are definitely different modes of ventilation that we can use, and those forms can be invasive or non-invasive. And so when a physician will frequently look at you in the middle of the room where we have the patient, the family, the other staff, but they will most likely look at you and say, what mode of ventilation can we use for this patient that is having a COPD exacerbation crisis? It's key to remember that a BiPAP machine should always be the first machine that we recommend for our physicians, because it's, first of all, it's non-invasive and prevents the patient from getting intubated. So in this presentation, we will go over key features of when a BiPAP machine should be used, some of the benefits, maybe some of the reasons when we can't use it, but ultimately why it should be your first line of use in a patient who is having a COPD exacerbation. So in this short amount of time, we will cover four main points when a BiPAP machine should be used on a COPD patient. Our first point would be, of course, when can we use a BiPAP machine on a patient? And that would be a patient that needs to have a respiratory drive, and means that they have to be able to breathe on their own. Yes, we can set up a backup respiratory rate on the BiPAP machine, but if a patient doesn't have a respiratory rate or a drive, they might not be able to trigger the machine. So it's very important that the patient can't breathe on their own, and then the machine would be there to just basically help and support that respiratory need. If a patient has had some form of major laceration on their face, or a lot of facial hair, or anything on their face that's kind of abnormal, where we actually can't apply the BiPAP machine, that would of course be another contraindication, because at that point in time we can't put anything on their face. If they maybe have facial fractures, we obviously cannot put a BiPAP machine, because that's only going to provide more pressure and make matters worse. Or the machine might be providing too much of a leak and not really give the patient the support and pressure they need. Of course, if a patient has had any sort of esophageal surgery recently, because we know once again that that pressure is going to go in and maybe undo the stitches or sutures, whatever is there, and provide a lot of that pressure and air into their esophagus or stomach. And another major component of it is a patient can't be claustrophobic. So as you can imagine, a patient that's already feeling short of breath, on top of that you add some claustrophobia to anything being on their face, and they're in complete panic mode because they feel like somebody is actually suffocating them as opposed to providing some sort of relief. The second key point that I would like to cover is how a BiPAP machine will actually shorten the length of stay in the hospital. We all know that once a patient is intubated, it increases the length of days they'll have in the hospital to generally up to 2 weeks. It can irritate their trachea, they might be on more sedatives. So all of those small parts can add to their hospital stay. We all know that intubation can also lead to higher mortality rates, because then the patient has a chance of getting hospital-acquired pneumonia, getting septic from having a multi-organ failure that could be caused by the endotracheal tube that leads to infection in other areas of their body, because of course, once again, it is intubating a patient is an invasive procedure. So those are some of the ways that it can really impact the patient's length of hospital stay and their overall outcome in their health after the hospital. Of course, we all know that if a patient is intubated, it's very uncomfortable to them. It creates a gag reflex. We need sedation to keep them calm. And so, of course, a BiPAP machine is a lot more comfortable for the patient, and they're able to tolerate it a lot better. It also helps reduce the work that their respiratory muscles have to do. So once again, it helps really take off that work of breathing that the patient has to do when they're not on the BiPAP machine. It really helps the patient breathe easier. So overall, the BiPAP machine kind of really helps take off that work of breathing that the muscles and the patient has to do, and just really helps support that with that extra pressure. So that's kind of the third point, and of course, the fourth point, key point that we will cover as to why a BiPAP machine is a good option to use in a patient who has a COPD exacerbation is that it improves the patient overall status, right? We know that it reduces the carbon dioxide in their body, helps relieve that work of breathing, it corrects their pH level in the body without having to intubate them, improves their overall oxygenation so the patient doesn't feel so air hungry and they're really struggling to breathe. And it really just helps calm the patient down. It helps them gain control of being able to breathe on their own again. It helps reduce their respiratory rate so they're not using all of those accessory muscles to try to maintain their minute ventilation, and all of those small fragments or parts just kind of help improve the patient's overall status and help them get over that COPD exacerbation hump so that way they can gain control of their own body. At this point in time, I would like to ask if, I know all of you are therapists, so if anybody has any additional feedback or questions about what we're covering, and maybe I'll even ask you guys of a couple questions to see if you can kind of answer them. Is that okay?
Yeah.
Okay, so my first one is, can you tell me when we cannot use a BiPAP machine?
If they have, oh no, go ahead.
They have like extra hair or extra like inflammation in their face that would make them suffocate or not breathe enough.
Yeah.
Or if they cannot breathe on their own.
No, like why can't we use a BiPAP on somebody? Right,
Oh,
if they
yeah,
can't breathe on their own,
exactly.
then they
Yeah.
don't have a respiratory drug. Yeah,
That's a good point.
absolutely. And then can you tell me what does the BiPAP do in terms of hospital stay, length of stay? Does it shorten it, lengthen?
Yeah,
Decreases it.
decreases the stay.
Yep. Any,
Also, recent trachea surgery.
somebody
I
has,
have a question also. So you're saying that does the mask, actual mask, comes in different sizes?
yes, it does. It comes in 3 sizes. I think it comes in like a small, a medium, and a large. So depending on if it's like a child we're using on, females generally have a smaller face, and then males generally will use the large on.
And also, are those available like upon the use? Like, are they like limited at the hospital, or is there plenty to use? Let's say if you had more than one patient needed the same day. Is that?
Yeah, most of the time there's enough equipment available and enough masks stocked. Any other questions? Okay, now that we have finished this segment of the conversation, of the presentation, we will actually go on and cover what kind of BiPAPs are on the market, how some of them function differently. Some of them have touch screens, some of them you actually have to dial in settings. So we'll just kind of cover different brands, how each one functions a little differently, and just even cover like different masks that we use for different machines.